Hello and welcome to Horizon HealthWorks. Today we are coming to you from Rutgers University in New Brunswick. I'm Laura Jones. In this episode, a first-of-its-kind partnership aimed at helping older New Jerseyans navigate their health care, a cooking lesson from one of New Jersey's finest executive chefs, and of course, our Horizon Person of the Month. First, you can see that this campus, like so many across the United States, are practically empty. Data shows spikes in coronavirus cases as dorms open and classes resume. Is this the beginning of the second wave or a continuation of what we've already seen? I have two people here to discuss this and more. Joining me first is Rutgers' own Dr. Martin Blaser, one of our country's leading experts in infectious disease. So, Dr. Blaser, thank you for joining us. Is this a first wave, a second wave? What can you tell us about where we are in this pandemic?
It's a little hard to say because the numbers are slightly inching up. My prediction is that the second wave will not be as bad as the first wave because behavior has changed substantially. And that's really the key to controlling COVID is behavior. The best solution is going to be vaccination. And if all of us can wait for vaccination and not get exposed and not get sick and not run the risk of dying, that's going to minimize the number of deaths that we're going to see.
There are many people who are kind of worried that there's a rush to get a vaccine before it may be safe.
Because of the severity of the COVID situation, everyone wants a vaccine yesterday. Fortunately, major manufacturers of a vaccine have said, we will not be rushed. We're going to do all the necessary safety steps. And I believe it. And in fact, we at Rutgers are participating in a vaccine trial also. We are committed to a safe vaccine. A safe and effective vaccine will cut down the number of people dying. So that it's the single most important step that will kind of minimize social distancing and masks. But I think we're going to have to do all of it combined, at least for some time.
Thank you so much, Dr. Blaser. Joining me now is Professor Patricia Whitley-Williams. She's an infectious disease specialist amongst pediatrics. Dr. Whitley-Williams, thank you so much for taking the time to talk to us. I was hoping you could kind of explain who it is and why more people in certain communities are affected than others.
Certainly. Thank you very much for inviting me to be part of this show. We certainly learn from our experience from the past 6 months that particularly people of color tend to be hit the hardest. There was just a publication from the Centers for Disease Control and what they call the MMWR. And it talked about the 121 deaths that were associated with COVID-19 in children. Among those 121 pediatric deaths, children under 21 years of age, there was also a disproportionate number of those deaths that occurred in Black and brown children. But we also know that there are many people who work what we call essential workers, who may work out in the public, such as transportation, or work in the hospitals, and have various jobs that actually give them more exposure to the public.
It's essential because that parent has got to continue to pay rent, yet you've got children who you might have to put in a daycare or hire sitters. How big are those factors weighing in?
Absolutely. We know overcrowding for sure. We know the essential workers because they're exposed more in the public. The other thing we haven't mentioned, of course, we know there is a disproportionate number of persons of color who have heart disease, who have obesity, chronic lung disease, hypertension, kidney disease. All of these are also risk factors for higher morbidity and mortality in relationship to COVID-19 infections. But COVID does not discriminate. And, we need to really obey our public health officials and do it for the health of the public. Yes, you may have a right not to wear a mask, but we're not doing this for your own individual right. We are doing this for the health of us all, for the health of the public in the United States of America.
Thank you, Dr. Whitley-Williams and Dr. Blaser. Those are great points you bring up to keep New Jerseyans safe and healthy, especially near major cities and those with underserved medical needs. Now, a new joint venture from Horizon that will offer a more stress-free and streamlined approach to healthcare for active seniors. I'd like you to meet Louisa Charbonneau, CEO of Brave in Health. Louisa, thank you so much for taking time to talk a little bit about this program that you have aimed at active seniors. Is it safe to say a program aimed at baby boomers?
Absolutely, and all seniors that are Medicare eligible. We really we focused on the individual in all of the whole realm of Medicare eligibility.
What it is that you're aiming to do for seniors who are, looking to stay active, because, people are not all retiring at 65 the way they did perhaps 50 years ago, 20 years ago even.
We have built this plan by listening to what seniors were missing in their current Medicare Advantage plans and the things that they really wanted. And those are the things that we added into this Medicare Advantage plan for them. And we have a whole host of benefits that support them both financially to make it affordable, to allow them to get the care they need at an affordable price, as well as some personalized benefits for them that can help keep them active and vibrant.
Who are some of these seniors? What are they asking for?
Well, an active means different things for different people, right? When I think about an active senior, that can be physically active, that could be mentally active. It really just means engaged and meeting them where they are. So if they're from a physical activity perspective, we all know that by staying physically active, it keeps your mind sharp, and it gives you a reason to live and engage, and gives you a purpose. But physically active can mean running a marathon. I know people who are in their late 60s who still run marathons. It can mean running a 5K. It can mean taking your dog for a walk every day. It could mean, being physically active could be, I want to be able to go up a flight of stairs without being out of breath, or I want to be able to get down on the floor with my grandchildren and be able to interact with them.
This program is personal for you. You've been in this particular area for about 15 years. So what is it that makes it more than a job for you?
Or maybe even more. Yeah. I grew up in a multi-generational household. My grandmother lived with us from the time I was born until she passed away, when I was almost 20. And I have had a number of older relatives, aunts, uncles, my parents, whom I have cared for, been their healthcare surrogate. I had my uncle who, God bless him, he lived to be a month from his 99th birthday. And up to about the last 2 years of his life, he was still traveling. He was mentally sharp. And I want to help people live the best life they can live. Really help them get the care they need, help them get the resources they need, and be as vibrant as possible.
What was it that you, in your experience and that you saw, wasn't addressing the needs of people?
And the thing that I've seen over and over is that lack of coordination between the plan and the doctor and the member. And it can become such a complicated, difficult situation when you don't understand how things are supposed to work, how the puzzle pieces fit together. And so to the extent that you can get the physicians, the members, the health plan, all on the same team, all on the same page, and make it as easy as possible, that's really, I think, a key element. And we offer dental and vision and hearing and over-the-counter drug benefits. And then we've got these great flexible benefits that allow people to say, hey, you know what? I need safety devices in my bathroom, and somebody else may say, you know what, I want a Fitbit. So we have some options for them to really personalize the plan in the way that meets their needs.
Thank you, Louisa. Excellent program that personalizes care for their members. This would actually be a great plan for my dad, who's at the right age and is very active. To find out more, log on to bravenhealth.com. We'll be back right after this.
How do you create a new Medicare Advantage plan that's truly different? You start with two of the biggest healthcare organizations in New Jersey with one mission in mind: provide the best possible care and the best possible Medicare Advantage plan. That's what Braven Health is all about. It's a brand new plan created by Hackensack Meridian Health and Horizon Blue Cross Blue Shield of New Jersey. It's a whole new Medicare Advantage experience with the right people working together. Braven, a new way to health.
Welcome back to Horizon HealthWorks. We're on the campus of Rutgers University at the SHI Stadium. Our new monthly series will bring you updates on medical advancements and the people who are making a difference in New Jersey. One person who is doing just that is our next guest, Rutgers' own Dr. Brian Strom, a nationally recognized expert in healthcare research and delivery. He joins us to discuss how New Jerseyans are getting access to cutting-edge trials and treatments. Thank you, Dr. Strom. So good to be able to talk with you. Why don't you tell us a little bit about what's going on right here at Rutgers?
Yeah, we have a ton that's gone on, and it ranges from, firstly, we rebuilt the organization. We got all new leaders, all new deans, all new directors, a lot of very exciting clinical care being given. COVID obviously was an enormous stress on everybody. We have 1,000 docs who participated in providing the care. From a research point of view, we have a series of particularly what we call our signature areas. Cancer, we're developing incredibly new approaches to cancer and cancer treatment. Approaches with infectious disease, part of why with COVID we were able to become almost overnight one of the nation's leaders in dealing with COVID, from diagnostic testing to treatments to providing care, as the case may be. Environmental health, multiple really high visibility stuff. And with that, we've really developed a great partnership with Horizon in the process. So I am co-leader with my partner at Horizon of a committee of people that basically look to trigger ways the two organizations can collaborate.
When COVID started, you had an infrastructure that was able to kind of adapt what you had already, some of the research and development you were doing, and were able to adapt it to help with the pandemic. Can you explain a little bit more about that?
We have an Institute of Infectious Disease and Inflammation, one of the leading programs of that kind in the world. But as COVID developed, which is both an infectious disease and an enormous inflammatory problem, we developed within a few weeks a rapid test for COVID that was then commercialized. The normal way to sample is to take what amounts to a Q-tip, stick it up one nostril as far as you can, move it all around for 10 seconds, take another one and stick it up the other nostril as far. It's very uncomfortable and slow and difficult, as opposed to the saliva test where you just spit in a tube. And we started with the ability to do 10,000 tests a day in the saliva test. We increased that with state support to 50,000 tests per day. So New Jersey is one of the states now that has the most COVID testing underway.
Well, and that is due also to the partnership that you have with RWJ of Rutgers and Barnabas.
We have a fantastic partnership with RWJ. So when COVID came together, it was a magnificent partnership across the Barnabas hospitals, across all the Rutgers infrastructure as well.
And you've got the money, the resources to be able to fund all of this as well. What I understand, more than anybody else in the state?
Correct, yeah. So again, the health system has given us a lot of money to be able to develop this. The state gives us a lot of money. And from a research point of view, national funding, federal funding, we get more Rutgers gets more funding from the federal government, more NIH money and National Institutes of Health money, than all the rest of the universities in the state put together. I'm happy to say, unlike elsewhere in the world, no one, to my knowledge, no one in New Jersey ever died due to lack of a hospital bed. No one died due to lack of a ventilator. No one died due to lack of an ICU bed. But it was nip and tuck all along. Tesla manufactured ventilators for us. And when the ventilators came and they didn't attach well to the, we turned to our engineering school to the 3D printing capacity to build the pieces needed to be able to make that attachment. I mean, it was a hand-in-glove, wonderful partnership between a health system and a university.
That's incredible to be able to be a part right in the beginning. What's your prognosis, looking 5-10 years down the line?
Oh, my goal from when I've been here now 7 years, is to build one of the best academic medical centers in the country with an emphasis on knitting together the entire state. And part of what will make us different is we have a particular interest and focus on population health, on keeping people healthy. And with that, we've really developed a great partnership with Horizon in the process. Don't wait until they're sick and come to you, but be able to reach out and keep them healthy. We are very interested in using the Horizon data to be able to look across the state at who's sick, who's not sick, who's going to need more care, who's not going to need more care, where do you deploy resources. Our goal is to keep New Jersey healthy.
Thank you, Dr. Strom. The Rutgers RWJ Barnabas Partnership was started with a $1 billion investment to get the best researchers working on innovative clinical trials. And while Dr. Strom is taking care of the future, our Person of the Month takes care of people today. Professionally, Betty Matthews helps Medicare and Medicaid patients with various disabilities, but in her free time, she dedicates her life to helping families overcome losing loved ones due to violence.
Saving Grace is a nonprofit agency for grieving children, for children who have lost a parent or parents to violence, or a sibling to violence where they're left without. We have a whole generation that's coming up. And if they don't have anyone to look to and speak to and talk to and learn from, then what are we going to have? We're set in the city of Camden, and so Camden is total remote. There's no hybrid. So a lot of these children won't have access to school supplies. A lot of them don't have access to food, basic necessities. And so what we did was, donation-wise, we went out, we grabbed up a whole bunch of school supplies, bunch of snacks, juices, fruit, and we made up little snack bags for them, as well as we gave out some book bags. We didn't really have a whole lot, but we did book bags for the little ones, which would include notebooks and pencils and erasers, those type of things that they wouldn't have access to. I love helping people. I love, my mom was like that, so it just trickled down to, it just seems like anything you can do to help someone only enhances your own life. We come across the children who, my birthday's tomorrow, but these people just came in here and shot my dad in my face. Like, what am I supposed to do? And so the pain of watching these children hurt because they don't know what's going to happen next is where we come in as Saving Grace. Today, this child may be preparing for prom. I have prom, and 6 weeks is my senior prom, and 2 weeks before prom, my mom just got killed. How do I go to prom? Am I even thinking about prom? What do I do with life with no mom? And I think about that with the loss of my own mother 12 years ago. At the age of 47, my first thought was, how do I survive without my mom? I didn't live with her. I didn't depend on her like that. And so anything I can do to help someone, it just feels like it enhances my own life. And it also takes my mind off of my own issues or my own problems, because then if you're thinking about somebody else, you're not thinking about yourself. So that gives me a break.
Oh, Betty, thank you. Those families are well taken care of because of your love and compassion. We'll be right back after this.
In uncertain times, you need someone who has your back. That's why at Horizon Blue Cross Blue Shield of New Jersey, we make sure our health plans have all the benefits you need. more ways to get care virtually, more support for your mental health too, more tools on your phone, all in a range of health plans so you and your family can find just what you need. And we can help, because everyone should feel like someone has their back, not just in uncertain times, all the time.
Welcome back to Horizon HealthWorks. Now, how many of you knew the answer was number 2, Princeton? I did, and I did so even before I read the script. And now, a success story. I want you to meet Julie Edwards, a nurse practitioner who is a champion for her patients. She's empowered to go above and beyond their mental and physical needs through a unique pilot program from Horizon called Integrated Systems of Care.
The goal of the ISC is really to bring all of those resources together in one place and help people navigate what can be a very complicated system.
This program, it's a little different in that you're not only a nurse practitioner, you're also able to work with and coordinate all of the different disciplines.
Exactly. So, when people come to us at CPC Behavioral Healthcare to start getting some of their mental health, behavioral health, addiction services, all those needs met, there's often all these other parts of their care that maybe they haven't had the resources to address yet. And so it's really great to be able to, provide the services that they came to us for, but then also meet all these other needs and help them navigate, is there a specialist that they need to see? Do they have a primary care provider? Do they need lab work? Do they know, what specialist is covered by their insurance?
And you've had some success with a particular patient, and we'll call him Derek to protect his privacy. Can you share a little bit about this particular person?
Absolutely. So Derek's a great example of how this program can really benefit people. He came to us with a lot of other things that needed to be addressed. And so while kind of doing that stopgap and providing some primary care services and helping him get on track with his physical health, one example is we found a thyroid condition that had been undetected, and he's really taken on a lot of new health goals. He's really changed his diet and exercise, which we've been able to help him at every visit along the way. He's been able to work on quitting smoking. He has regular follow-up with all of his specialists that he needs on board. So he's also, preventing a lot of the long-term health damage that could come from not addressing these things at a younger age.
Thank you so much for taking the time to talk to us, Julie. Really good. Well, as Julie just mentioned, one of her patients, his name is Derek, who's actually joining us now. Derek, thank you so much for taking the time to talk to us.
No, I appreciate you reaching out and look forward to helping people out in the future.
Right, and can you tell us a little bit about how you and Julie found each other and got in touch and began working together?
It's actually been a match made in heaven. Julie and I linked up post-treatment. She was part of my post-treatment recovery plan. She kind of handled the medical aspect of it as well as the mental health aspect.
What we're talking about, what you're having to deal with, is an addiction, and it came about because you hurt your arm, cancer in your arm, and a doctor handed you a prescription, and it took a turn.
It was a prescription given to me, perfectly legal, but it started a freight train rolling down a hill. And then before you know it, you're completely dependent upon it, and your entire life is revolving around a substance. When I went to see Julie was the fact that they kind of, CPC itself really looks at not just the mental health aspect, but they link up with your doctors and actually take care of the medical aspect.
How do you feel about the future? I understand you're over 500 days sober.
I think it's extremely important for people to hear it from someone who, look, am I a success story? No, I'm just 500 days clean, Every single day is a battle. Some days are easier than others. Nobody can tell you, nobody can do it. You have to be able to do and find what works for you. I was lucky to find Julie and CPC, and their program has worked for me. Obviously, the 3 previous times before it didn't work for me.
Thanks to you, Julie and Derek. So glad to see you're doing so well. Want you to keep it up. The COVID pandemic has affected so many of our nation's restaurants, food servers, cooks, and chefs. According to the New Jersey Restaurant and Hospitality Association, approximately 35% of restaurants are expected to close permanently this year. Our next guest, Chef Pam Green, was furloughed after 19 years as an executive chef at the Atlantic City Sheraton. Chef Pam is now changing lives and attitudes towards food at the Boys and Girls Club of Atlantic City.
We service almost 2,000 kids throughout the city of Atlantic City. And even through the whole COVID restrictions, we did run summer camp for 7 weeks, and we serviced over 150 kids in our 3 campuses. And now the fall sessions have begun, our after-school programs, and I teach the hospitality and culinary track, which means that the kids in one track who are juniors and seniors will be certified as ServSafe managers, which is a 5-year certification when they take their class and then pass in December, take the test. Plus, they're involved, we make dinner. Right now, the population is around 110 between the Drexel building and the teen center. 5 nights a week, we make dinner. We have to meet the Department of Agriculture requirements for proteins, starches, vegetables, and those menus have to be submitted and agreed to. But for me, the challenge is to create menus that don't use a lot of frozen food, that we make fresh stuff.
When you live in certain areas, certain urban areas, people don't always have access. So how big of a challenge is it for your students when you're teaching them, you know, here's all you can do? Do they have the access?
It is a challenge. Atlantic City is considered a food desert, which doesn't mean there's no food. It means there's limited availability of fresh foods. We're trying to do things to change that. We have a garden out back, and you'll see all the herbs I'm using today came from our garden. It's easy to grow potted herbs and even peppers, lettuces in pots at your house. So those are the things we talk about. We do garden club.
And I love that you're starting with young people because they can learn and take these ideas to their families and incorporate it in. Who are the students? Young people coming into your class. Is there a typical profile of a person in your program?
I wouldn't say any of them are typical. I would say they're all extraordinary. They're all intelligent. They're all really, really energetic. I mean, they are teenagers. They come from different racial and ethnic backgrounds. They're a mixed bag of diversity in talent, in brains, in attitude. There's a lot of rules in the kitchen for safety and health, and things are reiterated day in, day out to them. Like right now, I'm in the kitchen without a hat on, and I'm doing that because we're filming this. And normally I would have my hat on and a mask. But since we're talking and it's just me here, I'm breaking those rules for the moment.
When you are teaching these young people not just how to cook, but create and have something that is healthy and nourishing, you are also encouraging them to give back to community. Why do you see that as so important?
So we're teaching kids the importance of how to be prepared to go out into the world and join the workforce. To join the workforce as a young person or as an adult. It prepares them to think about how they should show up for work, what time they should show up for work, their attitude at work. They will have 1 college credit. They can graduate from high school with college credit. So there's a lot of pieces to the puzzle that we're creating here that are stepping stones out of being stuck.
I love it. You're giving them directions on how to cook and directions that are going to be applied in life no matter what journey they take. Thank you,
Absolutely.
Chef. Thank you for watching another episode of Horizon HealthWorks. We want to hear from you. Email us at horizonhealthworks@horizonblue.com. You can also tweet us at HorizonBCBSNJ or find us on Facebook. Until next time, stay healthy, stay Jersey strong. I think I got it.